Simone at Medicare with Adam. You're here because you have questions on Medicare. You're probably turning 65 within the next few months, getting bombarded with information, and just want to cut through some of the confusion. So, this is a little bit about me. We're a top rated local insurance agency, 5-star reviews on Google, also top rated on Medicare Agents Hub. Focus on education first. So, educating people on their Medicare options to cut through all the confusion that's out there. So, the first thing that you're going to want to think of is your initial enrollment period for original Medicare. So, when you're turning 65, that's when your initial enrollment period starts. It starts 3 months before your birthday month, includes your birthday month, and then goes for 3 months after. If you miss this timeline, you will be penalized. And if you're penalized, those penalties will last for the rest of your life and actually increase every year. So it's important to understand this timeline for original Medicare and not miss any of your deadlines. Original Medicare is Part A and Part B. This is where everything starts. And again, this is what you're eligible for when you're turning 65. You've paid into it your whole working life. Now it's time to start using it. Part A is your hospital coverage, and Part B is all your other medical coverage. Think of going to a doctor's office. Now, original Medicare is not going to include prescription coverage, which you have to get when you first go on Medicare, or you'll be penalized. And there is no annual out-of-pocket limit for original Medicare. So if this is all you sign up for at age 65, there's no limit to the amount of bills you could get if you use your health insurance. So it's important to understand, how do I limit those bills? So in addition to original Medicare, there's another decision to make. Either go with a Medicare supplement to pair with your original Medicare, or go on what's called a Medicare Advantage plan. You can only do one or the other. You cannot combine both. Now, if you choose the route of a Medicare supplement, it's going to pair with your original Medicare. You're going to have a monthly premium that you would have to pay to the insurance company. And then you'll have little to no bills that will come afterwards when you use it. Or if you decide to use the Medicare Advantage route, you will pay little to nothing to the insurance company every month, but you may have more bills such as copays and deductibles when you do go to use it. Now, again, these options exist because when you sign up for your original Medicare, there is no limit to your out-of-pocket expenses. Both of these plans would put a limit on those out-of-pocket expenses. So now you would know in a bad year, if you did have to use your Medicare insurance a lot, exactly what you would be responsible for. And one of the biggest questions I get is, I'm going to work past 65. What should I do? Simply put, you can either delay your Medicare and stay on your work insurance with no penalty, or you could sign up for your Medicare when you're turning 65. I would suggest comparing your work insurance to your Medicare to make sure you're getting the most bang for your buck. Because if you are going to stay on your work insurance and you're subject to a high monthly premium or the amount that comes out of each paycheck, if you're subject to a high deductible, Medicare plan may offer some more benefits or even a lower cost. If you are contributing to an HSA currently, it's important to understand that you cannot have any part of Medicare, as that would interfere. And if you have questions on how to do all this, which many people do, and probably why you're watching this video today, is there's no cost to my services. So whether you decide to do this all yourself or whether you decide to work with somebody like me, all the costs are already built into the Medicare plan you choose. So your costs will not go up by working with somebody like me, and you'll still get free local support and guidance just to make sure that you make the right decision. So if you would like to reach out, my phone number and my email are below. Thank you.